Dialing in from, we have a handful of people in Florida. A lot of the people here who are on camera are in the New York area. We were talking about how wonderful the weather is. People in Florida are talking about how hot it is. So talking about freezing your eggs will hopefully cool everybody down. Give us, you know, joke, but you get it. DC, LA. So great. We're so happy everyone's here. New Jersey, Fen, Priya, who's here. She's in Princeton. So maybe close, maybe not so much, but we're so happy everyone's here. Thanks for joining. We're just going to give it one more minute and then we'll get started. Okay. So welcome everyone. I think we're about ready to get started. So I'm going to hand it over to our panelists here. So Priya and Coco, why don't you kick us off?
Yeah. So we are starting off, if it's okay with you, Amanda, and I'd like to hover on the agenda screen. I thank you guys for joining us. We have a couple of things we want to get through today. My name is Priya. I'll introduce myself in a little bit, but just wanted to make sure you're not being spoken to by an unknown person. But we have a couple of things we want to get through today. I'm going to give it maybe another minute or so for some more of us to join, but these are the things that we want to go through. We're really excited to take you on this journey tonight.
Coco, if you want to introduce yourself.
Yeah. So I'm Coco. I'm one of the member advocates here at Cofertility. So my main role really is to keep you informed about the process. I'm the link between yourself and the clinic, and I also provide support and resources throughout your cycle. I'm a two-time egg donor myself, and I'm really open about my experience. I think everyone should talk more about, fertility journeys and have access to these information. So any questions you have on that front, I'm really open to share. Then I'll pass it on to Dr. Ulcha.
Hi, and I'm Dr. Mayor Ulcha. I am a board-certified reproductive endocrinologist. I am one of the co-founders of Summer Fertility, as well as our chief medical officer. And I love what I do, and I love taking care of patients.
And it's very nice to meet you all again. My name is Priya. I call myself patient champion. I will be helping you guys through the process at the clinic. You'll have constant feedback between Coco and I. And our goal is to make you guys all successful through this journey and feel very well supported.
Yeah, and one quick note is you can drop any questions that you have throughout this conversation in the chat, and we'll answer a few later on as well.
And I just want to caveat, if there's any question you don't feel comfortable asking in the group chat, if you please feel free to message myself or pull me, Priya, Coco, and we'll be sure to route them to the right person at the end of the presentation during the Q&A portion. So thank you. I'll kick it back off to you, Priya.
All right, so this one's for me. So who is Cofertility? Well, Cofertility was founded to help address a few key problems within the fertility space. So one of our main goals is to make fertility preservation more accessible, and that's through special discounts, dedicated one-on-one support from member advocates like myself, as well as access to our members-only community where you'll find peers going through their same journey at that same time. Unfortunately, for most people, the best time to really freeze your eggs is when you can least afford it. And no one really tells you that or talks to you about it. So we're really here to change that and open that conversation. So our program is split up into two separate platforms. Today, we're going to talk a little bit more about our Keep program, which is where you can freeze your eggs and keep 100% of them for yourselves. With Keep, it is self-funded, but we're able to bring down the cost with a few of our amazing partners like Sama to really help you reach your goals. With Split, you freeze your eggs for free when you donate half of the eggs retrieved with intended parents that you'll match with through our Family by Co program.
And well, what is Sama? Well, Sama is a fertility clinic. We like to think that we're a little bit different. We pride ourselves on knowing that we built the platform so that the fertility care can be given on your terms. And we really mean that. I mean, not only are we committed to giving really good care, but we want to make sure that it is minimally disruptive to your life. You'll see if you end up going through egg freezing, or if you talk to friends who have done egg freezing, it can be very disruptive. It means multiple appointments, it means multiple ultrasounds, many visits, and sometimes lots of travel, especially if you live in a location that doesn't particularly have good or close by fertility care or egg preservation options. And so what we've done is we've built a platform so that patients who don't necessarily live close to a fertility center, or frankly, patients that want some less disruptive options, can actually access good fertility treatment, or in this case, egg preservation treatment. And so while we do have a center in New York City, and obviously at some point, all of these things need to culminate in a procedure, what we do like is that the vast majority of your care, which is the monitoring, the appointments, the ultrasounds, the blood work, et cetera, can really be done virtually either at home or close to home in your comfort and on your terms.
All right. So while we're young, everyone really tells us how to not get pregnant, but no one really talks about, what your fertility outlook might be, or what your future family planning goals are. So I know personally for myself and about 28,000 plus Gen Z and millennials, my priorities really are focused on furthering my career, traveling, enjoying my 20s. And so maybe you're unsure if you want to have kids, which is about 24% of people, or maybe you definitely know you want kids, just about 68% of people in this study, but you're just not ready for them right now. Fertility education is really key to allow you to make informed decisions about your future family planning goals and decide what's best for you. So while egg freezing is not an insurance policy, and we don't like it when a lot of people say that it is, we believe that everyone has the right to, be experts in their own fertility and make timely choices about your own body and what your future is, knowing what those different options are for you. So at Cofertility, we focus on education. As your advocate, I'll make sure that you have all the facts and that you have support to make those decisions about your fertility. We also have a huge library of resources, and our medical advisors are also in our members only community if you have any questions.
So I'm going to take you through a bunch of slides now that really are meant to educate you a little bit about what egg freezing is. The short of it, I guess, is that egg freezing is a method for women to be able to preserve their fertility. We do it ideally at a time period of your life where the quality and the quantity of those eggs are still high, again, ideally. And we are able to extract those eggs from your ovaries and then freeze them where they sort of get frozen in this glass state. And it's really important because when they're not frozen, right, when they're not in that frozen glass state and they're in your body, it means that they're exposed to the regular things that you're exposed to, whether it's radiation or secondhand cigarette smoking, right, whatever it is that you're exposed to, not to mention time itself. When we talk about egg freezing, we kind of talk about quantity and quality, and they're a little bit different, right? So we have different ways of measuring quantity. We have some ways of measuring quality as well. I'm going to start with quantity because it's a little bit easier of a concept. So quantity is just the number of eggs that you have. And what we know is that when babies are born, they're born with a finite number of eggs. So we think that's something like 1 to 2 million eggs. And then as time goes on and you reach your adolescence and you go through puberty, your body unfortunately loses a lot of eggs each month. And then, of course, after puberty and you're ovulating 1 egg a month, the truth is behind the scenes, while you are releasing 1 egg a month, you're actually losing a bigger portion or a cohort of eggs every month. And that continues until something around the time of menopause, which is about 52 years old. And so what we'd like to do is we'd like to be able to measure the quantity. And we do that a number of ways. The most common way is to measure a hormone level called AMH, which is anti-Müllerian hormone. That is something that if you come through the Cofertility platform or the SAMA platform, we will do, and they will do. And that gives us a sense of how you are relating to your peers. And so it's something that we look at your age, and then we compare your age and your AMH with other women who are of similar age groups. Now, your AMH could be higher, which is great. We love that. That means that we can extract and pull more eggs in a given cycle. It might be average, which is also fantastic, and it might be lower, in which case it's a really good idea to know that in advance so that you can kind of think about maybe timing-wise if that's something that you need to do earlier as opposed to later. There are other ways we can measure quantity. There are some other hormones, but really the other best way to do it is by doing what's called an antral follicle count. And that's done with an ultrasound. Again, that is something that when you come through our program, we'll offer to you, and we'll be able to actually count the number of developing eggs, which correlates really well to how many eggs we can actually aspirate or retrieve when you go through freezing. Now, quality, right, is something that is much more complicated to get to. And unfortunately, today, we don't have any great tests that will measure the quality of the egg. The best way to measure the quality of the egg is to actually fertilize it and grow it into an embryo and obviously see if it turns into a baby. But if you're here and you're on this journey, you are interested in freezing eggs and preserving your fertility. And so that's not something that obviously is done. Outside of that, the best indicator of quality is really age. Age correlates pretty well with quality. And so we know that the younger you are, the higher the quality, the older you are, the lower the quality. And they both kind of come hand in hand often, but sometimes we see people that have high quality and low quantity, or the opposite. So it's really important that you get tested and you be proactive about doing this. So how does the whole process work, right? I think sometimes when you look at a slide like this, it's a little bit overwhelming, but I want you to kind of take a step back and remember that we are here to basically kind of hold your hand, right? That's why we have people like Priya and Coco who are on this journey with you, and we're going to take you from step to step to step so that it's not so overwhelming. The first part is what we call cycle preparation, and it is doing some blood work, some ultrasound. It's kind of giving us a sense of, what is the best protocol for you? How do we personalize this approach for you? We also teach you about the medications. We order the medications to you. You get to watch some videos and you do some educational modules. And then there could be some other things that we do. For example, we might talk to you about lifestyle changes that you need to make in advance. Sometimes we'll place people on certain vitamins, for example, that helps promote egg quality. So that whole piece is sort of what we call cycle preparation. And it can take a week or it can take a month. It's really variable and it depends on the person. The next part is really the meat of egg freezing, right? That's sort of like the bulk of egg freezing. That's what we call ovarian stimulation. So during this, it's about a 10 to 14 day period where you are going to be taking some medicine daily. Most of the medications we give you are injectables, but they're tiny, tiny baby needles. And I would say, like, by far the most common story I get is the very first time I did it, I was very nervous, I was very anxious, I had my friend with me. And then after I did it one time, I was like, oh, this is a piece of cake. Like, I don't know why I was even, going crazy over this. And most people sort of go down this, YouTube hole or the Google hole, and you realize that people are saying it hurts and this and that, and then actually you do it and you're like, oh, that's like a piece of cake. And that is really the most common story, but by far. So the good thing is that it's pretty quick, right? It lasts 10 days, 10 days of injections, sometimes a little more, but that's roughly where most people land. And then once we have identified that the follicles and the eggs are mature and they are ready to be taken out from your body, then we move on to this final step, really, which is called egg retrieval. That's sort of the final step that you have to do, at least. There are things that happen in the lab afterwards. So egg retrieval is a process where we do a very minimally invasive procedure, right? This is not major surgery, although we do consider it surgery. It is done without any cuts. There's no scalpels, right? There's no scars on your skin. It's all done transvaginally with a tiny, tiny baby little needle. And we're able to go into each egg and aspirate that egg and then bring it over to our embryologist so that they can check on it. That whole procedure takes about 10 or 15 minutes. It's typically done under some very light, mild anesthesia. There's no intubation, there's no tube down your throat, very, very light sleep. And the vast majority of people wake up kind of feeling very restful and happy, basically. Now, what happens behind the scenes is something called vitrification, and that's kind of just a fancy word for rapid egg freezing. We used to use a different process called slow freeze. That's really not something done in this country anymore. Vitrification really means that we take that single egg and we dip it in liquid nitrogen. It's very, very, very cold. It instantaneously freezes the egg. It looks like a glass, almost like a marble. That's really beautiful. And it stays frozen in time. And metabolically, it stays very, very stable. People have frozen their eggs for a month, a year, 5 years, 10 years, and we really don't see any difference in quality. Now, the last thing is really just your recovery, right? That is something that can take sometimes up to 2 weeks, but I will tell you that most people are going back to work 1 or 2 days later. They are waking up, they're taking the day off of work, the day of their egg retrieval. By the next day, they mostly feel fine. If you need some Advil or Tylenol, we can help you with that. It's very, very rare that we are giving people anything else more than just an Advil or a Tylenol. And I think you'll be sort of rest assured to know that your eggs are stored and safe and frozen, and you can move on with your life and not have to think about it. Now, who are people that pursue egg freezing, right? I think you can see on the right-hand side that it is a wide, eclectic group of people. I know Cofertility has members from so many different states, from different backgrounds, that have different jobs and do different things in life. And I think that's really amazing. I love seeing Cofertility members because we get to see pretty much everything, which is amazing. In terms of people that do it, the vast majority of people that freeze their eggs in general are doing it because they just want to preserve their fertility. That is by far probably over 90%. There are other reasons that one might want to freeze eggs. For example, you might want to donate to a family member that is struggling. Cofertility has a split program, right, where you actually donate eggs to an intended parent or a couple that have been really struggling to have a child, and that's an amazing gift to give to them. There are people that might want to freeze their eggs in advance of having some kind of procedure. Sometimes there are certain procedures or surgeries that could harm the ovary, in which case freezing eggs in advance of that could be a smart decision. And then occasionally we do run into some cases where people have cancer and need to unfortunately undergo chemotherapy or radiation treatments that, again, could be harmful to the egg. But I think we're all lucky to know that we do have egg preservation as an option for those kind of patients, and we're able to safely preserve their eggs before they go through some of these treatments. Now, side effects, right? This is a really common question. I get this with every single consult that I do. Everyone wants to know what are the negative things, right? And there are some negative things, but I think before we get into it, I want to just reassure everyone one more time that the vast majority of young women who go through egg freezing or egg preservation really rarely have any major or serious side effects. The most common things we see are things like bloating, breast tenderness, headaches, sometimes bruising. Really, people typically tell me that they feel like they're having a period. They feel that sort of like period cramps for a day or so. And that's okay. I mean, that is expected. The more stimulation you get, or the more eggs that tend to be retrieved, the higher the side effects could be. So if you are someone with very, very high egg quality and egg quantity, you may see a little bit more of those side effects. There is something called OHSS, which some of you may read about. It stands for ovarian hyperstimulation syndrome. It is something that we really try to avoid at all costs. Luckily, I can tell you that it is very, very rare. I don't even know if I can count on a hand how many times I've had a patient that has had any kind of severe OHSS. It's mild typically. And OHSS really is all of these symptoms that you're seeing. It's the headaches, it's the tenderness, it's the bloating, it's the mood changes, but the severe form of them, right? And then it includes other things that, that might make us want to watch you a little bit more carefully. I think, again, less than 2%, far less than 2%. And if you are going to consider doing egg freezing, that is something that you should talk to your doctor about, whether it's me or anyone else. I mean, that's a really good question because we can do things that reduce the risk of some of these side effects, like change the protocol or use certain different medications. Fitness, that's another question that I get a lot. Can I continue exercising? Can I have intercourse? And I typically tell people that what you want to do is you want to split your cycle in half, right? So you have part 1 and part 2. So the first 7 days, you can do pretty much whatever you want. There's no major restriction there. Your ovaries are still small. You're just starting stimulation. But the second half, right, that's sort of like day 7 to day 14, that's when you want to just take it down a notch. And I tell everyone, just, use your own judgment. You are the best judge of what you're doing in life. So use your own judgment, everything with moderation. You do not want to go bungee jumping, right? You do not want to go run a marathon. when it's the day before your egg retrieval, like just kind of, common sense kind of things. But overall, I don't think that you need to really change your life around for those 2 weeks. In terms of lifestyle restrictions, I'm going to sort of like flip this around and just say there's nothing that you really need to restrict, but there are things that you can and should do to hopefully make yourself more successful. So that means no smoking, minimize alcohol, 1 to 2 cups of coffee a day, make sure that you're exercising in advance, and just eating a good diet, and getting back to your life. Like I said before, within a couple days, you should be mostly back to normal. Within 2 weeks, you should be back. It looks like we may have some questions, so I'm gonna take a pause here, have a glass or have a drink of water, and then I'll let maybe Coco see if there's any questions there.
Yes. So one of the first questions that we have is, can I stay on birth control when freezing my eggs?
Great question. Also, probably one of the most common questions I get. So the short answer is you really shouldn't be on birth control when you're in active stimulation, right? Because we are the ones that want to control your cycle, and we're going to be giving you some different medications to help promote really good egg growth. However, it's okay to be on birth control before you start, and oftentimes many women are on birth control. If you are someone that is on birth control for a long time, let's say you've been on it for a year or 2 or 5 or 10 years, we might ask you to stop the birth control for a couple months, get it completely out of your system, get your ovaries nice and awake and moving, and then we'll go ahead and do that cycle for you.
One other question is also around birth control is, do I have to have my IUD removed for egg freezing?
Yeah, also great question. There are actually 2 kinds of IUDs, and the answer is the same for both, but just so people know, there are IUDs that have medication, typically progesterone, and then there are IUDs that don't, like a copper IUD. The good news is that if you're undergoing egg freezing, right, egg preservation, and you're not planning on getting pregnant right after, then you can keep your IUD in. It really does not affect or impact the cycle at all. However, if you are listening to this and you are thinking about getting pregnant and moving through the whole process and actually doing IVF, then yes, you would eventually have to take the IUD out before we put any embryos back inside. Similarly, if you're thawing your eggs because you did egg freezing and now you want to come back to us a couple years later, we would want you to remove that IUD.
Perfect. And then last question before we move forward. A few questions on medication. So one is, can I continue taking mental health medications, or if I'm on various other medications for my overall health, can I continue that?
Yeah, so that's a great question. And I would say that we take a personalized approach when it comes to patients who have either other kind of medical health history or medical history. And we work with your doctors and your healthcare providers. So I can't give you a broad statement like, yes, all medication is okay. What I can say is the vast majority of medications tend to be okay, and it's pretty rare that people need to stop them. However, right, when you have that consultation, when you're talking to us and you're telling us about what medicines you have and what kind of health conditions you have, that is where we kind of go one by one, very meticulously. And if we need to get in touch with your doctor, we do. It is not uncommon that I call other doctors on a daily basis and we treat patients together as a team.
Okay, thank you. One absolute last question before we move on is still on the birth control route. Someone asked about the subdermal implant, if they can continue that while on the medication.
Yeah, same thing. That as long as the implant is progesterone only, which is the vast majority of them, it should not really be a huge problem. But I will say that sometimes when patients have implants, if they are particularly sensitive, it might be wise to take them out. So that's another one of those sort of have that discussion with your doctor, check out what your hormone levels are, and then sort of make that decision. But the implant is a 50-50.
Okay, thank you.
I think the next slide is going to be about outcomes. This is something that I love to kind of pull up on my computer whenever I do consults with patients. And it's a really powerful tool. There are lots of calculators like this out there. This is one of the ones that I really like, where you can actually use some data and model out or predict your outcome. And it's important when patients are doing egg freezing to kind of think about, well, how old do I want to be when I have a child? And what is that family size going to be? Do I want one child, two, three, or four, right? Because those kinds of things are going to impact us recommending how many eggs you need, right? Do you need 5 eggs, 10 eggs, 20 eggs, etc.? If you come to us and say, hey, I want a basketball team, right? I want 9 children, then yes, we are going to tell you, you need to freeze a lot of eggs. And if you say that I only want one child, that answer might be different. But this calculator is just one of the many tools we use that help us predict your success after you freeze those eggs. So I think the one example we have here is a 33-year-old woman who has 12 mature eggs frozen. Well, that would mean that she has about a 75% probability of having at least one live birth with that batch of 12 eggs. Now, you could certainly have 2 children from the same batch or even 3 children, but the probability goes down and down. And you have to remember that while it only takes 1 egg to make a child, it's also true that not every egg is going to fertilize and not every egg is going to turn into an embryo and implant. And so that's why we always shoot a little bit higher.
Thank you, Mayor. So I have a couple of asks of you all. So I'm just going to go through some of the things that are kind of peripheral, but still part of the journey of egg freezing. It is a commitment. It's about 3 weeks, like Dr. Ultra mentioned, between treatment and monitoring. Again, we ask to avoid alcohol and recreational drugs. We want you guys to have successful outcomes, and this will help. We also ask you to kind of stay put, limit your travel, kind of stay local for a few reasons. We like consistencies on making sure you guys are going to the same place, staying in the same location, but also reducing the stress involved in travel, right? And the same thing in lifestyle, reducing stress. There's no way I can put you all in a bubble. I wish you can put yourself in a bubble during life, right? But at least reducing the stress is definitely the better way to go about it. I mean, think about it from the perspective of, I would never encourage a CPA to do an egg retrieval during tax season, right? Like, we all know that there's fluctuations in career and fluctuations in your job. So try to reduce stress. It'll be beneficial for you. And we, again, want to have the best supportive process through it. Next slide. Okay. So the Sama and Cofertility family experience is very important. First of all, between the Sama family and the Cofertility family, we're really here to support you guys through it. We really believe that, you know, this egg preservation journey does not need to be disruptive to your lives. So there's no need to clear your calendar, right? We're going to do this while you're having a job, while you're having an amazing career, while you're having amazing hobbies. We never want you to feel alone. We want you to know that both Coco and her team, myself and my team is available through text, call, email. We want you guys to ask us the questions. Dr. Ultra alluded to questions that are specific to you and your body, and it's important for you to share those with us. I never also ask my patients to ever apologize for questions. We're here to support you guys through it. We want to know more. In fact, actually, sometimes over communication helps us learn details that we possibly can support you through. We also want to prioritize affordability. We know that this is going to be a larger of an expensive ask of you. However, it is wonderfully one of the best things that you can do for yourself. So you feel like you're taking that step towards whatever your future may be. And remember, we're on your schedule. The way I like to say it is that we believe that we're prioritizing your fertility journey for you. And we want you to hold us accountable to it. We're here to support you through it. So let us know whenever you're ready, and we'll be there every step of the way for you. A little bit about also what Dr. Ultra alluded to about the Sama experience being fairly unique. All of these different gray boxes or touch points where on an average fertility treatment, you'd be going back and forth from the house to the clinic, back to the house again. With Sama, we have kind of modified ways to make this much more attainable and much less disruptive. This is happening at your house, or maybe at the OBGYN's office or a radiology clinic down the street. We're really limiting this travel, and the only one you're actually coming in for is the actual egg retrieval at the very end. Again, least disruptive to your life, no impact to your career. We want you guys to have this kind of seamlessly flow into your workflow. You folks are supposed to be living active lives. We're kind of just taking up a small few, minutes of it every day.
There you go. So I just to kind of piggyback on this a little bit, right? How are we different than your typical brick and mortar center, right? The major difference here is that we are proud to partner with some really amazing OBGYN offices, some amazing radiology centers all around the country. So that means if you don't necessarily live in Midtown Manhattan, that doesn't mean that you can't do this, right? You are able to get your monitoring, your blood work, your ultrasound with one of literally hundreds of partners of ours all across the country. We're able to get the results same day. We're able to review them and give you updated instructions so that you can get the same quality care, if not even better quality care. We have a second option, which is something that maybe some of you would be interested in, right? It's called at-home monitoring. That is a platform that we're really proud to have developed where we can send you a kit to your house. And it really is a small box that you get, and you're able to do your ultrasounds at home. It doesn't mean that you are doing it by yourself. No, you are actually guided, right? You're guided either by myself, by me, or one of our sonographers. They will show you how to use the machine. They will be looking at the images live with you. They are taking the measurements with you. They're telling you really move left, move right. And your job is just to kind of position the ultrasound left or right. And it's really as simple as that. And it's a way where we can get you to do all your monitoring. We can get the data that we need that, again, like Priya said, is minimally disruptive to your life, right? So that you can kind of go on really quickly, do your ultrasound at 8:45 before your 9 o'clock meeting. You do it at home. You don't need to travel anywhere. And that's, I think, the power of a tool like that. It doesn't mean that it's for everyone. And that's why we have lots of different options, but it's good to know that it's out there. And it is something that you can certainly use to your advantage.
I would have loved that for my cycle.
Yeah. Yeah.
And on that same note, yeah, we will support you through whatever that option may be. That's on our team here to figure out which is the best setup for you. When you do go through the process with us, I promise you that me and my team will go into great detail about the finances. I did want to reference it briefly just so that you had some sort of familiarity with the numbers. We at SAMA are proud to have this be 9250. That's 9,250. And through Keep Program's storage option, it's 1,750 for 5 years, which comes out to 11,000. We really want it to be affordable. We want it to be accessible. And that's how, we're able to bring this value to you. And I also wanted to kind of guide this conversation into a dialogue with one of our patients. She was able to use the at-home device. So I'd love to see if you guys can click through that and share that video. So.
I think the sound is coming off.
I don't think we're able to hear the screen.
Gotta share audio.
I am going to be 30 in a few weeks. I am an engineer for a living. My career keeps me pretty busy. We ended up pulling out, I think, 28 and 21, I think, made it into the freezer. My goal was to have enough for possibly 2 future live births down the line. And I'm very happy with one cycle, I was able to achieve my goal. This is my favorite part of the whole process. The at-home part has really kind of 2 big benefits. First is the obvious one. I don't have to go into a clinic every day or every other day. I was able to get the appointments done from the comfort of my own home, and I could go work a full work day, which I'm sure for many women is why we're egg freezing. We have busy work schedules. It was great that I never had to kind of adjust my professional life, and it can make all my appointments. And then the second reason I liked it so much is it sounds kind of corny, but I felt very empowered by it. I was taking the measurements myself on the ultrasound scanner. I understood what it meant. You're completely controlling the whole scan yourself. Everything's at your own time, your own comfort level. My name is Victoria. I
did want to share that she did mention that she felt like it was a gift to herself, which was a very well put way towards her treatment. Coco?
I love that. I think was some feedback from one of our Cofertility members. They weren't able to do our split program to donate, but decided to move forward with our KEEP program. One of the key takeaways that I loved that she shared was just how empowered and involved she felt in her own journey. Some background on myself, I've done 2 egg donation cycles, but I was privileged enough in that I worked at a fertility clinic when I was going through my treatment. So a lot of that knowledge and understanding I had just from the support of, what I did. But I think everybody deserves that type of access to know that what they're doing, that they're involved, they know exactly what's going on. So I love that she felt really empowered, especially with the ultrasounds, that the SAMA team, helped her to, get that agency and feel involved in her treatment. One of the other things that we love to talk about is that we have a member community where you can actually talk with your peers who are going through the same journey to support each other. A lot of our members will send encouraging words or give advice to each other, and it's also backed by experts in the field, such as our medical advisors. So lots of questions are always answered in our circle community, and we just like to make sure everyone feels empowered and really feels really hands-on in their journey.
We're going to wrap it up now. There's a bunch of questions. Coco and Freya, I'm going to hand it over to you guys, and you guys can just field the questions to the appropriate one. But thank you all. Again, start dropping some more questions in the chat, and we're going to go to that. I'm going to take us off, stop sharing my screen so that the focus is you guys who are answering the questions. So, yeah.
So Dr. Olcha, I'm actually going to have you answer this. One of our members here is asking, I'm an identical twin. Does this mean we have double the chance for eggs? And if so, if this is both donation and preservation of fertility?
Well, I'm not sure I totally understand that, but you both have eggs. You can both preserve your eggs, or you can donate your eggs, and you certainly can donate it to each other as well. What I would say is, technically, if you're identical twins and your DNA is identical, then the egg's DNA should be about the same. I would just kind of add that I have seen twins, even identical twins, that have slightly different egg reserve. So just because you're an identical twin doesn't mean that you have the same exact egg reserve. You've had probably different exposures in life, and so it's something to think about.
Okay. And right now, yes, we are based in the US. Our goal is to grow, but as long as you're in the US, we will support you anywhere you are within the 50 states. And actually, on that same note, I do want to make a note that, obviously, Dr. Olcha did mention it, but it's important for me to also mention it one more time. We love sharing the at-home device, but we do want to make sure that clinically we do get the approval. So worst case scenario, clinically we don't get the approval. Have no fear. We will find radiology clinics and OBGYN clinics locally to you. That is on me and my team to take care of. So you will be supported regardless. Dr. Olcha, what is the ideal weight to be in to get started on the process?
Oh boy. There isn't really an ideal weight, right? But there are certain criteria that we have. So we typically we use a term called BMI, so body mass index. That's something that you can calculate on your own. Ideally, the BMI should be in the normal range, right? However, that doesn't mean that you can't do egg freezing if your BMI is under or over. There are some problems with both. Some patients, if their BMI is under, they may not respond so well to medications. If the BMI is too high, right, the major issue is really anesthesia related. We want to be able to safely take care of you and make sure that we can safely put you to sleep and really minimize the complications. And so that's something that if the BMI is a little too high, we would have a consult with the anesthesiologist in advance of that to make sure that you're a good candidate for anesthesia.
Coco, there's a few donor split egg program questions that I'd love to chat.
Absolutely happy to touch on those. So with our split program, one of the questions is, are you able to choose the family that receives your eggs? So we try to focus on what we call a mutual match, which is where not only does the intended parents say they want to match with you, but you also feel comfortable to say that, you know what, you want to move forward. What that can look like is you can sometimes have what we call like a Zoom call, just like this, where you can meet with the intended parents before sharing any contact information, if that's something you're comfortable with, really just to get to know each other, ask questions. Sometimes if maybe you're not comfortable doing that, we'll ask the intended parents to share a letter or a video so you can learn a little bit more about them. But we want everyone to feel empowered that this is a mutual match. So we will confirm with both of you if you would like to proceed. So you can have a choice in that. And I think I saw another question about our split in terms of the donation. So if you donate half the eggs, will the 11,000 be waived off? So our split program is separate from the KEEP program. So 11,000 applies to that self-funding for KEEP. If you're doing the split program, it's completely free to freeze your eggs because you're donating half to the intended parents, and they're really funding the cost of that.
Okay. I see a question about what happens when we thaw your eggs and you're ready to come back to us for the journey. Yes, we will take care of you then. We will, at that point, whenever you decide whether that be a partner or a sperm donor, we will create embryos for you and then go through the rest of the process. Dr. Ultra, you want to speak briefly to what happens after we thaw your thaw your eggs and create embryos?
I mean, that's the most exciting part of this, right? That's where we actually get to really kind of bring light to life and complete your family. And that's, to me, that's really one of the more exciting parts when patients come back to us for that. The process, honestly, is really simple. The egg freezing part that's the tough part, right? That's the part where you're taking injections and medications and going through a procedure. The second part of this is where we thaw the eggs. Is fairly straightforward. We would decide how many eggs to thaw. Obviously, you would need a sperm sample, either your partner or some sperm sample that you select. We would do all that in the laboratory. You don't particularly need to be present for any of that. We would then grow the embryos for about 5 or 6 days in the lab. Sometimes we do some testing, some DNA testing to look for problems with DNA or chromosomes. And then we basically pick the best embryo for you. We prepare your body and you do the embryo transfer. That is done fully awake. It's very simple. It's not really a pap smear, but that's the best I could equate it to, right? It's basically a well woman exam. It's simple and painless, and hopefully in 10 days we get a nice call that you're pregnant.
Okay, I think I see a few more questions on our split program, so I'm going to touch on those. So is there anything that would I think that one is right, but what are the requirements for the split program? So there are a few key requirements that we have. One of them is an AMH level, which I know Dr. Ultra mentioned previously. So AMH is just a measure of your ovarian reserve. For our split program, due to certain clinic guidelines, we have a minimum threshold of 2.0 for the AMH. So if unfortunately your AMH is lower than that, you wouldn't be able to move forward with the program. We also have a thorough application that you'd have to fill out that just asks for some, medical history, family history, gynecological history, as well as personality questions that you'll fill out to just share more about yourself. Some of those family medical histories can be disqualifications. It's hard to give you exacts on this is a disqualifier here, this is a disqualifier there. It just all depends on the application. But the application is based on ASRM and FDA guidelines. So that's what we follow. After the webinar, we'll send out some email links that'll include the application and just some more from our Learn community. And then how soon are the donated eggs fertilized with the split program? Typically they're fertilized right away, but it depends on the intended parent. So some of them might, want to just have them frozen as eggs for now, depending on their needs. Others will fertilize them right away. And then where are the eggs that you get to keep stored if the intended family is in another state? So with our split program, we have your eggs transferred to our biorepository partner called Tomorrow. They're located in New York as well. And the storage will be there. So that way you can access the tissue whenever you'd like. It can be sent to any clinic that you'd prefer to whenever you're ready to decide if you want to thaw those eggs or utilize them. And then the last one I saw is the age limit for our split program. So our age limit is actually 33.5. That's just because it can take some time to go through the application and to get matched. So the official cutoff is 34. But we usually ask that you kind of apply sooner rather than later, just so we can, because it can take a while to go through the application process and find the right match for you.
I know, Dr. Ultra, you mentioned the fertility calculator as a great indicator, but one of our attendees asked, what is the success rate for a 34-year-old?
That's really going to be dependent, right? Let's just say if you're an average, right? If your ovarian reserve is average for a 30-year-old, then your success rate is going to be really high, basically. That's kind of like the upper limit where we don't see many differences between, for example, like 30, 31, 32, 33, 34. It's at 34 that things start to kind of come down. So there's no great way to measure success when we talk about egg freezing. When we talk about IVF, success is obviously having a baby. For egg freezing, I think the best way to measure success is, did you get the amount of eggs that really are good enough for your family planning, right? That's kind of how we measure success. So for someone who's 34, who's otherwise healthy, I would say you're a great candidate and you should be very successful.
And to also mention that, Dr. Ultra did reference a few more other tests that are key indicators before we get the process started. I know there was a question in there as, how do you measure fertility and how are your successes? I mean, one of the things that we do insist on is doing a little bit of pre-testing before we get started, just to see how you will do, if there's any modifications that we would need to make specific to your body. And that's part of that assessment planning phase, so that Dr. Ultra and his team can make sure that they're doing the right treatment for you, for your specific body type.
And there are a few more questions as well on the split. So one of the questions is about this member lives outside of the US and wants to know if they can still move forward with our program or if they need a social security number to apply. You don't need to live in the US or have a social security number to apply, but your treatment and your screening will happen here and your eggs will be stored here. So we do ask that if you want to apply for our program, you have to be able to be available in the US for both your screening and the actual retrieval cycle, which is about 2 weeks. And then there's another question on if they can speak to someone about just the egg donation process. So I myself am an egg donor and I have loved being a donor. I hope to do it again. So a little bit more about my experience. I worked in fertility clinics, and that's really how I became comfortable becoming an egg donor, just because I've worked with a number of patients going through IVF and really suffering and struggling through their journey. And for them to really decide that they wanted to move forward with egg donation was very hard for them. And it just kind of spurred me wanting to help in any way that I could, because I wasn't really tied to my biology and my genetics in that way. And I just figured if I can help someone else have a baby, why not? So I've had what we call an undisclosed and a disclosed donation, where my first relationship, I didn't know much about the intended parents. It's what you would quote unquote call anonymous. In my second, I had a disclosed donation where I got to meet with the intended parents before we move forward, really ask each other questions. We talked about like traditions that they want to, have with their child, and they connected and asked me, are there any traditions that I do with my family that they can, continue? So I really loved donating, and I'm also very open about that experience. So if you have more personal questions on, any hesitations you have, I'm happy to speak with anyone about it. I usually will. We'll send out an email you can use, but we can usually schedule some time that you can talk with us, just to share a little bit more about that.
I think, Coco, there's one more split program question that I think is
very that.
Coco, you are very popular today.
I expected. I love all the questions about our program. I'm really happy that I joined Cofertility, because this is literally what I love doing, talking about egg donation. But let's see. With donated eggs, if they were to result in a pregnancy at the age of 18, would a child from my donation be able to contact you? That depends on a few different things. I would say, with the advancements of genetic testing and technology, if you are to donate your eggs, there is a chance that that donor conceived person could reach out to get more information about you. With our program, we have what we call disclosed and undisclosed matches. So undisclosed means that all communication is done through Cofertility and no contact information is exchanged. And a disclosed match is where you can, communicate with the intended parents. You can have some level of your contact information, but the amount of communication, the type of communication, that's all dependent on what you're most comfortable with. For myself, I have an email that the intended parents can use if they have medical questions for me. I'm comfortable with the donor conceived child reaching out at any age, especially once they're 18, if they want more information or want to know why I donated or questions about my family. But it's based on what you're most comfortable with. if you aren't comfortable maybe with someone reaching out, that's something you can talk about with that agreement that you'll have with the intended parents, but there is no way to guarantee anonymity, unfortunately. And how many members have participated in the Split and Keep program since the company started? That's a little hard to quantify because we have so many. With our Keep program, I know we have hundreds of people that we're connecting with different clinics and providing information for. With our Split program, we have thousands of intended parents looking for donors and hundreds of Split members that are matched all the time. So I don't have exact numbers on that, but we have our companies continuously growing, and we're hoping to reach even more people and help other people be able to preserve their own fertility.
I see a question on the other side about any forms of assistance if you don't qualify for the Split program financially. At SAMA, we do work with a few different partners, but I'd be more than happy to kind of go into it with you when you have our financial call with us. We really want to support you through this journey, and we do have some partners that we really do enjoy working with. So we will definitely, give you more information about that when we do have the finance conversation.
Is being over. Oh, there's a question about BMI related to our Split program. So because we do have to follow specific clinic guidelines as well as ASRM and FDA standards for egg donation. So unfortunately, there is a BMI cutoff. While we acknowledge that BMI is not a perfect system and really doesn't necessarily need to be used in all medical regards, we do have to follow clinic guidelines. And we're hoping that eventually at some point that we'll be able to kind of move away from a BMI system, but it is a factor that we do have to consider in the application. Any other questions? Oh, there's a question for Dr. Ulcha. What are the types of injectable medication we should expect?
That's gonna probably depend on the protocol, but it's probably one of three categories is how I would explain it, right? So there is a category of medication that allows for the ovaries to be stimulated. So that's typically a derivative of FSH, which is follicle stimulating hormone. So obviously it's in the name there. It is actually the same thing that your body normally produces. So it's a human derivative. It's a human analog, I should say, except that we give a little more of it. So your body is typically going to give a little bit of this FSH. It's going to be produced by the brain and then make its way down to the ovaries. And the goal is to make one egg ovulate. Since our goal is to get more than one to ovulate, we would really supplement you with additional FSH. That is one of the injectables. The second type of medicine is what we call an antagonist. That's, again, a very common protocol. And that is a medicine that prevents early ovulation. As you can imagine, when we are doing egg preservation cycle and there are 10 or 15 or 20 eggs growing, we really want to make sure that you do not prematurely ovulate and lose those follicles. And so at some point in the cycle, typically around halfway, we start you on the second medication called an antagonist. The last medicine that you're on is really what we call a trigger. And it's a medicine that helps mature the eggs so that once we get them out, we're able to fertilize them. That's sort of just a one-time dose. You just take it a day before the egg retrieval, and then that's it. That's the last thing you take.
Dr. Ultra, we have two back-to-back very good questions. If I wish to freeze multiple times, how much time in between treatment and procedures is expected?
Great. So that is going to depend. If you had a really robust outcome, you were able to freeze 10 eggs, 15 eggs, 20 eggs, right? Then we would probably want to give you at least a month in between to kind of let your ovaries settle down and go back to baseline. If your egg reserve was a little bit lower and we were only able to get, let's say, 2 or 3 or 4 eggs, sometimes in those cases, we can actually do back-to-back cycles without having any time in between. So, both are options. In either case, what we would typically do is reevaluate. So we would do an ultrasound before you're ready to start, reevaluate, and try to give you the best treatment.
And is there an average number of eggs extracted with the anesthetic procedure, or does it depend on age?
There really isn't an average. It 100% definitely depends on age. We do have some sort of metrics on that. In fact, I'll try to pull something up. Yeah, so that can average from one egg, right? And all the way on the extreme, it can average to 20 or 30 eggs sometimes, especially if the AMH levels are really high and if the age is closer to that 25, 30 age group. So no great average, definitely depends on age. And when you have that consult, we'll go over that.
See, there's a question for you, Dr. Ultra, on does having ovarian cysts complicate egg freezing?
Yeah, so the answer is yes, depending on how big it is, right? And maybe even depending on what kind of ovarian cyst it is. Ovarian cysts come in lots of different flavors, right? There's simple cysts, there's complex cysts, there are dermoid cysts, so there's lots of different kinds of cysts. In general, if it's something small and simple, oftentimes you could just kind of go through and continue with the cycle, which is great. If the cysts are a little bit larger, typically 3 centimeters is the usual cutoff. Or if they're complex, then we may have to wait a month or two to let them dissolve and go away. And then we start at that point.
Questions coming.
Oh, this is a really good one. Does freezing your eggs impact your ability to naturally get pregnant?
Oh, great question. Well, the answer is no, not at all, actually. There's lots of data on this. When we freeze your eggs, right, we are not taking away any more eggs than you would have lost anyways. So essentially what's happening is that your body in the beginning of a month when you have a period is going to select, right, a group of eggs. It might be 10 or 15 eggs. And when you go through a cycle, you're going to ovulate one, but those eggs that you didn't ovulate, they tend to dissolve anyways. So the good news is when we do egg freezing, we're actually able to stimulate and save extra eggs. And then it has really virtually no impact on the chance of you getting pregnant at all. In fact, there's even some anecdotal data that says when people have their ovaries stimulated, they can be actually hyperfertile. So you want to be very careful.
And also, do irregular cycles lower your chance or the amount of eggs?
Irregular cycles in and of themselves don't necessarily lower your chance. But if you have irregular cycles, it means that we just have to do a little bit of better prep work to make sure that we're starting you at the right time of the month so you have the best outcome and the best success.
There's a question on what do we do next if you want to get started. Okay, so in terms of what you can do next, I'm going to drop one of our email addresses in the chat. Just if you have any additional questions, you can always send it to us because we won't be able to get to everything today. But some of the next steps that you can do is just really reach out to any of the Cofertility team. And we can provide you with more information on KEEP as well as information on applying for our split program. One other thing to note is this webinar is going to be recorded and we'll send out an email following that, but you can expect some email communication from the Cofertility team following the webinar. And then also access our Learn page, which Pomi just linked in the chat as well. We have really great articles and resources there. So if you need you have any additional questions, you can always reach out to the Cofertility team.
Well, we are all excited to be a part of this journey, and I hope that I get to meet some of you in person at least. Would be honored to kind of take you through this journey, and I'm sure hopefully you get to meet Priya along in my team, and obviously Coco from Cofertility. And I thank you Cofertility for having us and hosting this, and we're excited for all your members.
Bye everyone, it was nice doing this with you.
Thank you for
Bye.
the time. Have a good night.
Thank you. Bye, everybody.